This talk explains why Dr. Maya GPT is the future of healthcare. Every conversation about healthcare today revolves around diagnosis. Governments, medical institutions, AI developers, investors, philanthropists, and patients are obsessed with improving diagnosis and treatment. But have they ever stopped to ask what diagnosis actually means? Or why did doctors invent names for diseases in the first place? As a doctor, diagnosis is the last thing I think about. We must not treat a patient based on what they feel is wrong with them or diagnose them with an illness or disease they unwittingly take ownership and live thinking about it until they die. I don't think many doctors read the letter I published in BMJ in 1996. I said, doctors must listen to the story of the illness as they have lived, experienced, and remembered it. They must search for the underlying cause, understand the pathophysiology, the biochemical and physiological changes in the body, and offer a solution and not a prescription. A disease name is just a label to make the patient happy so they can tell others about the illness and not say doctors don't know what is wrong. This increases their anxiety and consult another doctor or waste time searching for online information. Why do we name illnesses? When a baby is born, the mother's first question is it a boy or a girl? Not, is my baby healthy? Similarly, when patients visit a doctor, they expect a name for their condition, so doctors name the organ add suffixes like itis in the end, for example, tonsillitis, bronchitis, or arthritis. For example, arthritis, nephritis, or carditis. In the past, words like idiopathic, iatrogenic, allergy, and now virus is used often. These names only describe an organ's inflammation, not its cause. But every disease, including cancer, is inflammation, so if another doctor hears the diagnosis, they will not contradict it, but will accept it. Infections, autoimmune reactions, or biochemical imbalances can cause inflammation. The problem is that we don't know the exact cause 90% of the time, so doctors prescribe drugs like steroids to suppress inflammation or antibiotics, even when unnecessary, hoping to reduce anxiety. That specified. This traditional approach to medicine is deeply flawed, leading to the overuse of antibiotics, misdiagnosis, and unnecessary treatments. Most doctors often perform tests not to confirm the cause, but to protect themselves legally. This is why we need Dr. Maya's GPT. Doctors treat symptoms, but do not spend time trying to identify the causes or educate patients. After tech giants started creating symptom checkers and information about symptoms or signs, it was difficult to please patients. I realized this in 1990 when I published the first website, gotosurgery.com, a decade before the tech giants copied it to commercialize. We know drugs seldom cure, but doctors were forced to prescribe them because of patients' demand because they can only alleviate pain and suffering. Unfortunately, these drugs, like opioids, are addictive. I felt sad when I read 108,000 drug overdose deaths occurred in the 12-month period in 2022, like Michael Jackson. Imagine a patient comes in with a sore bum. A proper doctor will examine the area and check for ticks, lice, or a simple pimple. Yet, I've seen cases where doctors refer patients for a colonoscopy instead of looking at the bum. This is how the medical system wastes time and resources. Doctors are also quick to prescribe antibiotics, even when they know an infection is viral, because bacterial infections may follow. However, misuse of antibiotics has led to the creation of antibiotic-resistant superbugs, increased cancer risk, fungal infections, autoimmune disorders, and even obesity. If you consult a doctor with a symptom or a sign that is not serious, the doctor will have to justify your visit and so will perform tests and prescribe vitamins or strong painkillers like opioids that are addictive. So, the next time you think you are unwell, ask Dr. Maya GPT because knowledge of health is knowledge of life. A doctor's job is not rocket science, as you have been made to believe. Diagnosis and treatment are not based on tests or investigations, but only using common sense. Listen to what Dr. Maya tells